The following is a Cable 14 special presentation.
Good evening. A year ago this week, life changed. A global pandemic was declared. Cases of COVID-19 became a reality here in Hamilton. And on March the 12th, the City of Hamilton initiated and stood up its Emergency Operations Center. My name is Paul Johnson, and I am the General Manager of the Healthy and Safe Communities Department at the City of Hamilton, but also the Director of the Emergency Operations Center. And for a year, we have been working with a number of colleagues around the table at the Emergency Operations Center, helping to understand the course of this pandemic, helping to keep our responders safe, keep our community safe, and ultimately chart a course for the end of this crisis. You know, I think back a year ago to the day before we activated the Emergency Operations Center. I was in a gymnasium doing what I love outside of my work life, which is being involved in refereeing basketball. I was observing and evaluating officials at a high school provincial championship. There were 700 people in a gymnasium. I was ducking under the bleachers every once in a while to take calls from our medical officer of health and our acting city manager about what was going to happen the next day. We were unmasked, we weren't 2 meters apart, and we didn't really know what this coronavirus was going to mean to our community. That next day, the group that gets together when we declare the activation of the Emergency Operations Center gathered at our facility, and we started to talk through what was happening in our community. And very quickly we realized that this was not going to be a short emergency or an emergency where only minor adjustments needed to be made to our services and advice provided to the community, that this was something much larger. And by day 3 of our activation, we were planning for the complete shutdown of city services from a public standpoint. We were talking about how we would be able to deliver our essential and critical services and keep them going through what was a growing and worsening pandemic. And we were engaging all of our partners to help them get ready for what we knew was going to be increased work and increased anxiety in those early days. And so when you think about gathering in large groups, not really understanding what was happening with this virus, to where we are a year later, the incredible pain that this virus has inflicted on our community. For some, very bad illness. For others, regrettably, death. Almost 300 people have lost their lives in this community. And that tells you something, that this isn't just about closing facilities or perhaps having a few restrictions in place. This is a life and death battle that we've been in for the past year. Beyond that, the impact to business, the impact to families, the impact to all of those things that make us a community can't be undersold. And throughout that, we've been trying to work together as a community, and I think we've done a great job. Tonight, you're going to hear in person some conversations with folks that have been on the very front lines of helping through this pandemic. And then you're also going to see some testimonials through a video of many more Hamiltonians who are sharing their experiences. Some are painful, some are inspiring, but all are very real and raw, and that's really what this last 12 months has been all about. And so this is going to be a conversation not of celebration. It's not an end to this pandemic. It is a reflection on what this 12 months has taught us and what we need to do in the remaining months of this pandemic as we look forward to brighter days. And to start things off, I'm really pleased to be chatting with our mayor. Fred Eisenberger is the mayor of the city of Hamilton, and he and I have had so many conversations, I'm sure neither one of us can keep count. In those very early days, the communication was often. He is an individual that I have received guidance from. He has been a great sounding board throughout this pandemic in terms of all of the activities at the Emergency Operations Center. And he has been a key leader and communicator of what we've tried to do over this last 12 months to ensure Hamilton can fare as well as was possible. So Mr. Mayor, thanks for joining us on this show, and thanks more importantly for your leadership.
Thank you, Paul. And yes, it's been quite a journey. I'd like to call it an acknowledgement of the last year of challenges that we've all faced together. We've said over and over again, we're all in this together, and certainly it's been a global experience that has affected every community right across the country, right across the province, right across the world, and no different here in Hamilton. And who'd have thought that we would have had the kind of dramatic changes and lockdowns that we've experienced this past year. So yeah, it's been quite a journey. It's been a collaborative one. It has taken all of our resources and our manpower and our individuals in our community to actually step up and participate, including all of our citizens out there that have stepped up in a big way to follow what I initially thought was, how do we get people to do this? How do we get people to lock down? How do we get people to not go outside or play at the playground? Or how do we get people to not visit their gym or their rec center? And the reality is people understood what the impacts of this virus was, even though we were learning as we were going in the early days. And if I think back to those early days, there was a bit of a belief that we're going to be in this for a few weeks or maybe a few months. And then once we were in it for a few months, I think the realization came to us that this is going to be a long-term process. In the absence of a vaccine and the absence of having that available to us, we are going to be at this for quite some time. Now, I wouldn't have guessed a year or more, and this is now going to be a year or more. And then we start thinking about what does recovery look like, and how long is that going to take? And I think the positive I take all of that is that the community as a whole has come together and has gotten us to this point. If it were not for the citizens of Hamilton saying yes, we're gonna participate, we're gonna do our best to stop the spread of this virus, had we not had that kind of level of support in the majority of our citizens out in the community, we would be in a very, very dire circumstance today. And so credit goes to our citizens out there that have done a great job.
So let's go back to those very early days, those first few days, because you and I would have these chats in that Thursday and that Friday when we were just activating the Emergency Operations Center, and our feeling was we needed to, curtail some activities that had large volumes of people coming to our facilities, or look at a few of the events that were going on and maybe scaling those back a little bit. And then all of a sudden by that Sunday where you and I had that chat about we're going to be closing our facilities to the public, and suddenly talking about people staying at home and not going out except for essential reasons. What went through your head there? You're the mayor of a city of some 540,000 people. You are the leader of this community. What was going through your head personally and privately at that moment when you realized that this was something that was far more significant than I think we thought on that Thursday and Friday when we first kicked this off?
Well, that's it's always a bit of a moment of shock. You're facing a circumstance that you've never ever seen before. And in my political time here, I've seen lots of things, but never anything to this kind of scope and scale, and a requirement of a mass participation in the community at large. And I as I said earlier, to this day, I'm still surprised how well people have actually taken the message. And my worry early on was exactly that. Like, how are we actually going to sell this to the broader community? How are we going to tell them not to go to the playground with their kids? How are we going to tell them to stay home and stay within your own home and don't go out? And when you're out, stay 6 feet apart. And you witness people actually at that moment in time, walking down the sidewalk and seeing somebody coming and going to the other side of the street to avoid meeting up with that person because they understood that there was a virus out there. And then the second part was we have a council, and the council has a number of individuals on there that have particular points of view, and there was a need to bring them along and have them understand the importance of this kind of measures, because they needed to be our additional ambassadors out there saying this is the right thing to do, we need to move forward on this please everyone participate. So you quickly kind of scroll through your mind, how is all of this going to happen and how is all this going to play out? And there's no playbook for it. Early on, the messaging was quite confused. It was, it started off with, there's a couple of cases, nothing too terribly to worry about, but, let's just see how it goes, to all of a sudden, it looks like these things could spiral out of control and now we have to close everything. That's a shock to the system. For a politician to go to their community and say, you need to follow all of these rules and regulations, and you need to stop meeting with one another, and you need to stop going to playgrounds and gyms and all the things that you enjoy. That is not something that anyone wants to share with their community. And so I think I took a few days to process, how is this all going to play out and how is that community reception going to be? And fortunately for us, the community reception was actually very strong.
That's an interesting piece because, at the Emergency Operations Center, we have our role. We're making decisions based on the best information we can, but there's this other layer to that, is that once that's out there in the community and it's communicated, people aren't looking to staff members in organizations, they're looking to the leadership and, in our case, the elected officials. So talk to me a little bit about, your thinking. You've done things like create a task force on economic recovery. You've worked very strongly with the council. You've been a key communicator along the way. How has it been in this political realm for you to do that role in this community and really find ways when much of it is being decided by the province or the federal government, but to find a way for local government to be really meaningful for people during this pandemic and as we look for recovery?
Yeah, and I think the key issue there, Paul, is that I think we agreed, and I certainly, from my perspective, it was how do we communicate effectively with our community? What tools do we need to employ so that we can get to people and have them understand what this all means? Try to make sense of the recommendations that we're throwing out there. Why is it that they can't do all the things that we're asking them not to do? And how do we effectively communicate that and use all the tools, whether it's radio, television? You end up, if you're the mayor of a community, then people expect to hear your voice, telling them what your views are and what your thoughts on about where we are and where we're going. And so we early on decided that that was a part of our communication strategy that had to be deployed, so that people would understand that there was unity in the recommendations that we were putting out there. That there wasn't a divide between what the staff were saying and what the elected officials were accepting. That we were on the same page, we were working together, and that we were working with our federal and provincial partners, which was also a key component to ensuring to people that we were not out of sync with our federal and provincial partners in terms of the kinds of directions that we needed to take. Now, having said that, there is always the opportunity for others to get out of sync. And so trying to keep that unified approach going is not an easy task. You have people, different voices with different ideas about what's appropriate and what's not appropriate. You have different elected officials that might have different views. So how to maintain that level of unity was, I think, a particular challenge. And then you add to that, as we've all experienced in our community, there's a level of anxiety and worry and concern about how is this all going to end up. I'm not devoid of worry. I might have a cool, calm demeanor when I'm on the air, but I'm as petrified as anyone else out there in terms of what does this all mean, and how do we come to the end of this thing? When can we have the vaccine? How is that going to affect my family? What's it going to do to my kids that are teaching in schools that have young kids and are now have to do online learning? So all of those impacts and the potential of, am I going to get it or have I had it at some point in time? All of those concerns and worries, I think, landed on all of us, no matter whether we're at the highest level of government, making the decisions in terms of direction, or whether we're at home, as my wife would say, who retired at the beginning of the year just before COVID, retired into nothing, and all the anxiety and worry that comes with that. So there's a lot of thought and worry and sleepless nights and moments where you wonder, how are we going to get through this? But always buoyed by, we're not in it alone, we're in it together, and we've got a great team that we're working with to help support one another to get through this, not only for ourselves, but for the community at large.
When it comes to an emergency operations center, people come to that table and often take on different roles. We're all trained in terms of those different roles, but it is often outside of what we do on a day-to-day basis. Take Grace Mader, for instance, who we're going to have a chat with now. Grace is a colleague of mine in the Healthy and Safe Communities Department, is the Director of Children's Services and Neighborhood Development, and has been a leader in early learning and childcare for many, many years. But at our Emergency Operations Center, she is our operations chief. All of the operating departments, including some external organizations such as the police, report into the operations table. And Grace, when this whole thing began and you got involved in the EOC, did you really understand the role of the ops chief for this emergency when you first started?
Thanks, Paul. No, not at all. It was a trial by fire right off the bat, and that we were fortunate, though. All the members of our Emergency Operations Center are incredibly kind about helping you along the way, and so it really was a team effort. Everybody bands together and you kind of figure it out as you go along.
But the reality is people don't stumble into roles, and Grace, you're no different. Early on, we recognized pandemics. They are human services and human crises and emergencies. So talk to me a little bit about how your understanding of the social service network, your years of work at a community level, how that's helped in those early days of understanding just the impacts this was going to have on vulnerable populations, but moreover the connections that you have in the community, because the reality is the city can't do it all.
Absolutely. So we were really fortunate here in Hamilton that we've always had a lot of community partnerships. And it really is those relationships that you lean into and you access. It takes everybody to jump into, and we were really fortunate in the human services area. All of our social service supports, grassroots organizations, everybody stepped up. When we put a call out to having to increase shelter spaces and things like that in our community, we reached out to our partners and the operators, and everybody was more than willing to augment their services, ramp up their services, and pitch in.
How many dinners do you owe when we finally can get back to having congregate gatherings?
I think I'm owed a lot, and I think I owe a lot.
But let's talk about some of those areas. You mentioned homelessness, and of course homelessness is a crisis in this community in any given moment, and then layer on a pandemic, layer on the infection prevention and control measures that are necessary. This has probably been the largest ramp up of service that we've needed to do, an adjustment to services. And just give us a bit of a flavor of what started as early as late March of last year and has continued to roll through the past 12 months.
So in those early days, we had to really pitch in and reach out. We had to look to the men's sector particularly to ensure that we could space individuals out safely within the existing locations, and we realized pretty quickly that we didn't have enough space. So we looked to open up a temporary shelter with our partners at First Ontario. Spectrum Entertainment were unbelievable when we reached out to them about utilizing their space. They were basically whatever you need from us, and they were more than willing to help us. We had to look to help with security. We looked to help with some other community supports for food. Everybody stepped up to it. It took everyone, though, to try and figure out what are all the things you need to have in place in order to successfully accomplish this. And as I mentioned, food deliveries and things like that. But it couldn't just be food in the normal way a shelter provides it. It had to be individually wrapped and individually available so that we weren't bringing people together in unsafe ways to eat their dinners. It also took us, the learning as we went along about, as new information became available about what measures had to be put into place. What were the level of cleaning that you needed to do at any one location? What was the level of the PPE, the personal protective equipment? Every day it seemed to change in the early goings on. And we also had to look as we went through it in the spring and into the summer about how are we going to operationalize this for what originally we thought would maybe, hopefully be a short time, then quickly realized as we moved along that it was going to be for a much longer duration. And now we're into 2021 and we're still looking at how we're problem solving it through the duration of this year as well, to make sure that people are going to be able to be cared for safely in the right, that operators have the right equipment and the right locations, and that individuals will be safe in those environments.
One of the rules of emergency management is don't let the perfect be the enemy of the good. Decisions need to be taken quickly. And your last comment there twigged something in my head. Take us through just how things have improved and how you've looked at things differently as you've gone through this. I expect that some of the things you did in those early days obviously changed as we went through that. You consistently brought back new ideas as to how we could do a better job of making sure those folks in our community were safe.
I think that other than the phrase PPE that we all learned pretty quickly, I think the next most common phrase was pivot. As we went through, you set up one thing and you quickly realize, okay, we need something else, we need something more. One thing would beget the next. We quickly realized in the early days too that in order for people to remain in their homes, those who had challenges of getting out for groceries and access food, we developed a vulnerable supports team. We pulled in people from all over the corporation to help us with that. Individuals from rec centers that were now shut down were suddenly, into delivery agents for us, to make sure that we were getting deliveries of food to each of the home. We partnered with Food Share, who could not have been more phenomenal in this as far as, how can they help and how do we access the food there and get that out to all of those individuals so they could safely remain at home. We were saying, don't go out, don't go to the grocery store if you're over a certain age or if you have some vulnerabilities. So every day was a bit of a learning opportunity for us. And like I said, when we would establish that, okay, that's not quite working quite right, move into a different way and find a different mechanism. As things started then reopening in our community, we quickly realized, well, we can't have those individuals. We're called back to some of their work opportunities as things started to open up. You had to look for a new group of folks to tap into so you could keep the services going. And we're still there now. We still have a group of staff that are providing those supports out to individuals and trying to work through as to what that next iteration is going to be as we move through this.
10 seconds or less, what would you say to the thousands of people that have helped you through this last year in your operations role?
Oh my God, thank you. It's the biggest thing I can say. Everyone has been unbelievable. We are an incredibly fortunate community, and I've been very fortunate through it to be part of it and feel like you've contributed.
Well, I'm really happy to welcome our next guest. Dan Mckinnon is the General Manager of the Public Works Department at the City of Hamilton, a colleague of mine on a day-to-day basis in our work at the city, and has been at the Emergency Operations Center since day one, helping us to respond to this pandemic. Welcome, Dan, and to start things off, you are in a role where you're delivering services through your department that are not office-based. People can't just work from home. They deliver these critical services to people each and every day out in the community. In those first few days, when we finally, I think, realized at the EOC that this was going to be a big deal and that this was a really serious situation, take me through your thinking as you were trying to wrestle with how you were going to continue to deliver those very important services in the midst of a virus that we didn't know much about and an emergency that was clearly growing.
Definitely in the early days, there was a lot of anxiety around the precautions that we were going to need to take and how the heck are we going to continue to provide the services. Most people who are watching may appreciate that Public Works provides essential services to the city, whether it's related to drinking water or sewage systems or road maintenance and that kind of thing, HSR bus service. But certainly in the early days, a lot of people went home for the first couple of weeks because we were struggling to understand what kind of presence could we have in the workplace and what services were going to be absolutely essential versus which ones could we park for a little while. So lots of anxiety in those early days, lots of long days, as you know, and lots of meetings with the Public Works leadership team. I think the thing that we relied on the most was the guidance from the province and from our local public health folks to help us understand what were the infection control procedures that we could put in place to make sure our staff were safe. So In the early days, it was really just understanding the kind of the limits of the virus and what kind of activities we'd be allowed to carry on with and make sure that our staff were safe.
So talk to me about the staff reaction, because you know, like the work that I do in my department, a lot of these folks are frontline, but not frontline in a healthcare way, and not frontline in terms of understanding the pandemic. So, you know, how were they reacting to the situation in those early days? You talk about lots of conversations, but what were the kinds of things that were front and center for them?
Yeah, so I do say this with a lot of personal pride. I work with a lot of really, really talented folks, and they have a really kind of get it done mentality. And certainly within the public works, we have a lot of services that we provide that may not be so obvious to the community. And one of the areas that really stepped up in this regard was our facilities section. The city owns and operates and maintains over 500 facilities. So in those early days, it was Rome D'Angelo and his team. They had to figure out, what does it take to actually shut down a facility and then reopen it with respect to how you do air handling, the HVAC systems, the mechanical. They had to develop all kinds of signage to put in place to make sure that any of the facilities that were going to remain open, that the appropriate measures were put in place. So it really was a scramble in the early days, just trying to use their imagination to figure out, how do we put wayfinding signs on the floor, and how do we do signage, and how do we get a hold of all of those, you know, plastic barriers that we were going to need when we started to reopen. And for those areas that had to stay open during the early days, how did we make sure that our staff were going to be safe? So it was a real yeoman's effort for Rome and his team to make sure that that happened. And you know, one of the quiet stories that most people don't know about is Rome and his team also had to set up an entire warehouse to help with the logistics around PPE, not only for long-term care facilities that the city owns and operates, or paramedics or the fire service, as well as our own staff, but we also were providing a really crucial service to local primary healthcare institutions, be it Hamilton Health Sciences or St. Joseph's Healthcare. So Rome and his team, they were doing an extraordinary amount of work in behind the scenes to get that type of infrastructure in place, so that we can not only support the services that the city provides, but other healthcare institutions within the city.
Yeah, it's one of those stories of the pandemic over this last year, is people doing things that they never signed up for. I mean, if you and I had been wiser, we would have had a lot of signs and plexiglass barriers in our basement ready for this, but we didn't. And so people had to scramble, figure out how to do it, set up a PPE supply depot that we had never done. And you're right, people just stepped up, did it, and didn't push back. Dan, last question for you. Your own leadership in the department, reflect on what had to change for you through this, and what have you learned about leadership in the midst of not being able to be as together as we normally are, not being able to visit as many people. Share with us a little bit about how you've had to change and what that reaction has been like now that you've been doing this for 12 months.
Yeah, I guess from my perspective, you know, the good things that I like to do on a regular basis from a leadership perspective, I think it just had to be amped up, and it just had to go farther and deeper and longer. And so I guess what I mean by that is, you know, circling back with your team members to answer as many questions as you could, to let them know when you didn't have the information that, you know, but you were going to find it. Reaching out to folks who maybe you might have got a bit of a clue that they were maybe struggling a little bit because of the pressure. So many people were working very long hours, 7 days a week, using all kinds of imagination, inventing all kinds of processes. So making sure that, you know, you're available for them whenever a phone call came in, even if you had to step away from a meeting, being available, making sure that you know, you kind of had a bead on how people were feeling, and just you know, just being as supportive as you possibly could, because we were all in territory that we've never been in before, but you know, just being a support to them, and really that's good leaders, I think, realize that they're there for their teams, to support their teams, not necessarily the other way around. So I think just amping that up as much as I possibly could.
Dan, you're a great leader. Time and time again, that's what we hear back, is you were informing your teams, helping them to feel that they were protected by you and the organization to do what was critically important. We couldn't stop some of those services. They needed to keep going, and I'm so proud of the city as a whole just continuing to do that work. And thanks for being a great partner around the table at the Emergency Operations Center. Well, there are all sorts of essential services in a municipality, but none are more important than the transit system. And if you think about the importance of that to move people to all sorts of things on a regular basis, but in a pandemic, how do we get essential workers who don't drive to their jobs so that they can protect the community? Well, when the pandemic hit, that fell on our Director of Transit, Debbie Dalvidove, for her to sort out, manage, and wind our way through. And I need to start, Debbie, by first congratulating you. You've announced your retirement, a long and stellar career in transit. It began you're a transit operator. You actually know transit from the driving of the machinery right through to the highest levels of management. Congratulations on that announcement. And what a way to go out. Talk to me about being the Director of Transit in the middle of the worst pandemic since 1918.
Well, thanks, Paul. And yes, it is quite the way to go out. Certainly nothing that I had experienced or throughout my last 34 years. And, early on when, the COVID-19 first landed here and really nobody knew what it was about, what was happening, we still had to have those services on the street. And I have to tell you, I could not be more proud of my team back in those early days, almost a year ago, and how we all pulled together, the frontline staff, management, the union executive, to try to figure out how it was we were going to keep those wheels of the buses turning and out on the road to get those essential workers to their jobs. So it was quite the undertaking from the perspective. We had no playbook, but what we did know is how to deliver services and to plan for whatever eventualities we might be facing as far as scheduling. In those early days, we didn't even know if we would have operators that would be available to come into work. But we did know that we had to make sure that we maintained a service that our customers could rely on and that those essential workers could get to those very important jobs. And as the pandemic played out, we saw just exactly how crucial it was for them to be there. And again, extremely proud of my staff for everything that they did to make sure that the HSR really, shined so brightly through what was a pretty dark time, especially in those early days.
And we can't underscore enough the partnership of everybody to keep transit going. Not all communities were as lucky. They had shutdowns of transit. And, in those early days, what were we told? Don't be too close to each other. Don't be in enclosed areas with each other. We didn't quite have a handle on masks in those early days. And here you are with transit operators sitting in a relatively small enclosed space with lots of people getting on and off the buses on a normal basis. What were some of the things that you knew you had to do in order to protect those workers, make sure that we could keep transit going as we learn more about this virus?
So certainly at the beginning of the pandemic, trying to get our hands on some personal protection equipment, hand sanitizer, when there was nothing to be found. We really took the lead from what we were getting from our public health partners. And in those early days, as you said, keeping our distance and ensuring that we could do that and modify our buses in a way that we separated our customers from where our operators were, so that we could keep both our customers and the operators safe, as well as trying to figure out how we were going to move so many people with less people on the bus. Public transit is mass transit, and having to only have 10 people on a 40-foot bus and still get those people to where they were going. So that's where we did all our planning and ensured that we had some extra buses and staff out there. And then as more information became available, then we adapted, and we some days had to pivot within hours in order to address those new concerns as they arose. And very proud of the fact that we were leading the GTHA in initiatives that we were doing at the HSR to ensure that reliability of service, and proudly we're able to keep the service running the entire time and to this day, and right until we come out of this pandemic.
In our last minute and a half or so, Debbie, talk about things going forward, because as great a job as we've done of keeping the buses on the road, we're now back up to a higher capacity of people on the buses. Transit's taken an incredible hit. Not as many people out, not as many people using it. What do we need to do to ensure that transit comes back as strong as it was pre-pandemic?
So, of course, the vaccine will be a pivotal change for us in the ability to start now putting more people on our vehicles. And we're going to have to wait and see exactly what the long-term effects are in people's travel patterns as it relates to public transit. Maybe our typical rush hours won't be in the times that we've previously experienced, and so we're going to have to adjust, and we're going to have to find ways to ensure that that we're meeting our customers' expectations. And before the pandemic hit, we had embarked on our Re-envision project, and it's going to be crucial now for that information and those learnings that we've got from our customers pre-pandemic, and now having that ability to reach out to those customers again to find out what it is that it's going to take them to come back to transit, and how we can again start building on that momentum we saw before the pandemic hit, to ensure that we increase ridership and make HSR everything that it can be for this wonderful city of Hamilton.
So we've been looking back over this past year of the pandemic, but for some in our community, it's been more than a year. Our public health services in the city of Hamilton were already into their emergency planning mode in January of 2020. And as a community, all communities are well served by their public health units. In Hamilton, we're lucky to have such great leadership as our Medical Officer of Health, Dr. Elizabeth Richardson. She's been through SARS, been through H1N1, has a long history of work in public health, and has a long history with the city of Hamilton. So when this all started to kick off, I was very comforted in knowing that she was doing those early things that we needed to do to get prepared. She is also, most recently, a Women of Distinction Award winner in our community. Dr. Richardson, it's great. For those who are listening, I'm going to call her Elizabeth because this is a fireside chat and that's how we address each other. But you and I talked in early January of 2020 that you were starting to execute on your Emergency Operations Center. Did you know at that time just where this would be heading?
Paul, when we see a new virus emerge, we really hope this isn't where it's heading at all, that it's just something new, that it's going to be quickly contained, or it will turn out to be something quite mild that maybe is very limited in terms of its spread. But as we started to see it come out and started to see the first things of what was happening with the cruise ships, if you remember what was happening there, that's where we started to become really quite concerned and say, okay, the degree of illness that's associated with this, the speed of the transmission that is associated with this. And of course, with those cruise ships, we were already seeing the early days of the impacts that it would have on older people, since many of those cruises involved people who are older, and the challenges that it faced from a global perspective and the response. So, while we initially, were just watching and waiting, as we've watched other things before, we've had Ebola scares, we've had all of those sorts of things, but this time around, it was really looking like it would be something more serious.
So public health services in Hamilton, always ready to jump into these types of activities. Nothing like this has ever come across our workspaces and your workspace. But SARS, H1N1, other outbreaks that we see in small ways through our communities at various times throughout the year, how did that prepare you for the large-scale response we needed for coronavirus?
Well, that is the thing about Hamilton, is unfortunately we have had a number of responses from the standpoint of both infectious diseases, but also environmental emergencies. If you take us back over the years, we've certainly had those as well. And so we've done a lot of things to prepare for them. On the one hand, it is the planning, it is setting out, initial responses. What is the framework that we're going to follow? What are the steps that we need to prepare for? And ironically enough, the exercise that we did just in the summer of 2019 was around vaccine distribution in response to a new virus. And so there had just been an exercise done on this. So we do exercises and that sort of thing as well. But we know at the core of any sort of response, it's the relationships across all of our partners that really is what holds us together, the relationships inside our department, the relationships across the city. And so we're building those all the time. We're working with each other on these issues. We already had a table across Hamilton that had come together in H1N1, in SARS, and had worked together on those issues. And so without those critical relationships and the preparation across all of the city and the health system, that we wouldn't be able to do what we're doing today.
So talk about where we're headed with this. We all got very familiar with public health measures, keeping our distance, wearing masks and things like that. Now we're starting to get used to another piece, which has been around for a long time, vaccinations, but on this scale never seen before. What can the community expect as we move through these next number of months and actually start to roll out this vaccine in larger and larger ways?
Well, the vaccine has just been such good news in terms of having one available as quickly as we have had to combat this particular virus. And so what you'll see as the vaccine supply starts to increase is we'll continue to roll this out in larger numbers. So the province has told us that we can expect more supply, and so we'll start opening up larger clinics. We'll also be working with our other partners, whether they're in pharmacies or primary care or paramedics, looking at how they can begin to be part of the vaccine rollout. So as we know now, we have AstraZeneca, and that it is a vaccine that can be more easily moved as opposed to the ones that require really big deep freeze, like Pfizer and Moderna. And so you'll start to see it become available in other situations and it be more accessible to people across the community in that way. So this is going to take months, though. Like, this is not something that's going to be done quickly. So people are going to need to continue to be patient as it rolls out. The province has set out an approach, a prioritization framework to, first of all, to save lives and to protect as well our healthcare system as we go forward. So going down through an age-based approach and with those who are most likely to get more severely ill. So we can definitely expect to see that. The other thing, though, is that we're going to continue to need to follow public health measures. And that's going to take us some time while we get vaccination rates up and while we make sure that the vaccination stops the transmission of the virus at the same time. So it'll be several more months of working this through. And then hopefully coming to a high enough level of vaccination to make a difference.
Medical officers of health are often referred to as the people's doctor. Rather than a roster of patients, you're looking out for the well-being of, in our case, about 540,000 people in the city of Hamilton. What message, in the last few seconds that we have, what message would you have for the community in terms of what they've experienced for the better part of a year and what they're going to experience as we go through the next number of months?
This past year, we have seen impacts. We've talked about these before, the disproportionate effect on our racialized communities, on women, because of the caring professions that they take on and many of the frontline positions. We've seen families that have had to go through loss without being able to mourn properly or to connect with people who have been very sick. We've seen businesses, we've seen, huge impacts. And of course, all attendant with that is the impacts on mental health. And so as we move forward, we've definitely seen some things. There's definitely lots to be hopeful about. And there is lots that we can do together as we move forward. But that's where we do need to continue to focus, is how do we move forward? How do we get through these next few months? And how do we rebuild? This whole discussion about rebuilding together, building back better, Paul, even a key part of that, and talking about housing in this community, and how can we build back better in long-term care, in our housing services. Our health system has learned so much. We didn't do virtual care really before now, and now we've got systems that are built upon it and expectations around that. And so there's really a lot to look forward to, and we need to be quite purposeful and intentional as we go there. And we're going to be in an even better place as we come out of this, I've no doubt.
It is wonderful to see where the end of this pandemic lies with the mass vaccination of our public. And we encourage everyone to continue to do the things that will keep us safe while we wait for that vaccine to get in our community, and step up and get that vaccine. It is the way that we'll get back to a life of less restrictions. I want to bring the mayor back in for one last question and comment before we go to a video. Mr. Mayor, as you know, we've spent some time talking to Hamiltonians, some who work for the City of Hamilton, others who work in different places in the community, and we've asked them to share their stories. And some of those stories are incredibly painful, some of them are incredibly inspiring, and all of them are just the rawness of what this pandemic has meant to them over the last year. What are your thoughts and your words to this community as we look forward to the next number of months and getting back to a place where we're less restricted in what we can do and we can enjoy community the way we should enjoy it? What are your words to the community that's endured a year of this, has some months to go forward as well?
So going forward, clearly the vaccine is accelerating. We're closer to getting back to some sense of normality than we've ever been over the last year. I would encourage everyone to get the vaccine. It prevents death and prevents hospitalization And we're going to make sure that when that second dose is necessary, that people get it, and that everyone that wants a vaccine, and I would certainly encourage everyone to take it, is going to get one. It's not like we're going to miss anyone, or anyone's going to be ignored, or we're going to pass anybody by. But unfortunately, we have to have a process, and that process is something that's evolving right now. And so we've prioritized the essential workers for obvious reasons. The healthcare workers that have done such a terrific job of keeping, people safe and actually having people recover. And even though we've had 300 people die, we've had multiple more cases, thousands of cases, and most of those folks have recovered and gone back on to kind of the regular community activities. And so the healthcare teams have done a terrific job. Our frontline workers like paramedics and firefighters and police have done a terrific job. Grocery store clerks that are out there every day making sure that people were getting what they need to conduct their lives and keeping our city functional. All of those frontline workers, whether they're city workers or police or fire or anyone else, they've done a terrific job under difficult circumstances. And so now we're closer than ever. There are hopeful signs that we can get back to some sense of normalcy, but at the same time, some patience is required and some added protections. The protections that we've had in place now for the better part of a year still have to be adhered to until 75 or 80% of the population is vaccinated. And if we can get through that process, and hopefully that is shortening now based on the flow of vaccine that's coming into us, that if we can get that done in a matter of 3, 4, 5 months, then we'll put this pandemic behind us and then learn the lessons of where the inadequacies have been throughout this pandemic, and hopefully start putting them into practice, better outcomes for individuals that have been severely negatively impacted in our community. So I'm right now feeling very hopeful, very positive about where we are, but ask people to still be patient, because it's going to be still a difficult journey, but everyone that wants a vaccine is going to get a vaccine. And the moment that we have sufficient numbers that have had that, we can get back to some sense of normalcy.
Mr. Mayor, thanks for being here with us. Thanks to all of our guests who have shared their stories in person with me this evening. And we're going to leave you with the voices of our community, who will be sharing some of their stories from the year that was, as we look back, a year of this pandemic, and look forward to the end of this pandemic.
COVID-19 has affected myself both personally and professionally. Back in March of 2020, something that we've never seen before, not allowing our families to be able to come in to visit the staff and the frontline people leaders, not just in our homes, but across our long-term care community, is next to none. The time away from their families to be able to support and care for our residents here.
I have a 97-year-old mother, and she resides at Mckinnon Lodge. She's 97, she's blind. This time of her life, I need to be with her, my brothers, my sister, anybody, and nobody can get in to see her. It's very sad. It's not like some people can pick up a phone and do FaceTime. She can't see. That just adds more anxiety, not only to her, but to me too.
I used to be a very athletic person, and now I'm a completely different person. I've kind of lost who I was and don't feel like I am the same person that I was before I had COVID-19. It's affected me both mentally and physically. Physically, I still am suffering from symptoms, extreme fatigue and weakness, body pain, joint pain, brain fog, and memory problems. Mentally, it's been really hard, increased depression and anxiety.
It's affected me both personally, as family, and professionally in running a childcare program. When COVID first started and we were mandated to close, it was very difficult because we thought, how are we going to sustain our program? We were concerned for our families, our children, and how we would manage. I feel at a loss because there's only so much we can do to help families. We're there for them. They're wearing masks and goggles, which is really hard when you're working with little children.
And most importantly, how do we keep the little people that come through our doors every single day safe? Particularly when it's hard to tell 2-year-olds, oh, don't share that, don't put that in your mouth, So we really had to roll up our sleeves and figure out those challenges.
When daycare is reopened, they have done everything they can to keep our center and our kids safe, and yet every day I drop my daughter off on the way to work, and every day I have to push aside feelings of guilt and worry. I get emotional just thinking about it. Am I making the right decision for her? Is she safe? I'm her mom. I'm supposed to protect her. At the same time, we have to work.
Being a frontline worker, there is an element that I could be worried of contracting COVID-19, but for myself personally, I do look after my health as a priority. The way that COVID-19 has impacted my life professionally has been put to a halt. We have a driver's lounge here where obviously we would congregate, get ready for our shifts. I can't high-five a colleague for a great job or sit down and eat lunch together.
Hi, I'm Joanne Santucci, Executive Director of Hamilton Food Share. When COVID hit, we had to reimagine everything. We had to reinvent processes. We had to make everything public health related in everything we did, times 13 organizations, And then in the middle of that, with no volunteers, and the local supply chain choked just in the middle of starting to order food that we needed.
The situation in shelters is really quite critical. It was before COVID and even more so now. One thing COVID has demonstrated is the ability within our community to really collaborate in effective ways between healthcare providers, community agencies, the City of Hamilton, volunteer organizations to respond with urgency and with compassion to ensure that people who need shelter are able to access it.
Well, my name's Judy Parsons. I live in Ancaster, Ontario. I'm a single mother of a 23-year-old special needs child. I initially contracted COVID latter part of October. Taylor attended her day program back in August. It reopened again with safety precautions. I felt totally safe with sending her back. The latter part of October, I received a call from the program saying that there was a little guy that was obviously tested positive. Taylor was in that group. My experience with COVID was actually very terrifying. The initial thought process is hospital, ICU, ventilator. Having a special needs nonverbal child, it was very scary. The shortness of breath, the fatigue, the loss of sense of smell, the loss of taste.
As a recreational therapist, we're called to do a lot on the floor, whether it be doing FaceTimes with family members or just trying to find unique ways to, bring that morale up in our residents and, just find ways to have fun. I was diagnosed with COVID back in the first wave of 2020. During that time, my work had actually had gotten place for a bunch of us frontline workers to live in a hotel close by so that we wouldn't be able to possibly infect our families during that time. I was exhausted. I was sleeping maybe 14 hours of the day when I was in the hotel room. Also too, just a really high fever.
It was my week to do the groceries. So I picked up groceries for my mom and dad. On the Thursday morning, I went to their house. All I did was open the front door. I dropped off the bags of groceries. I waved hello and I left. On the Saturday of that week, Public Health contacted us and they told us that my mom and dad had been exposed to COVID and they were admitted into the hospital that Saturday evening. My son and I were also tested. We both tested positive. I was also admitted to the hospital. And I was also in ICU. And they actually put me in the room next to my mom. I think it was May 26th then, the doctors came in and told us that the COVID had taken over my mom's lungs. And I'll never forget what a nurse at the hospital told me when they did the x-ray of my lungs. She described it that your lungs look like they're filled with broken glass.
On a professional level, it's It's been exhausting. The case that stays with me the most is I've been working the COVID assessment clinics as part of the COVID effort. And earlier on, there was a man that came in who was short of breath, who was in his 60s, and he just came to get swabbed because he thought he should. He had nothing else wrong with him. We could tell he was sick, like sick right away. And I went into the room and he was just struggling to breathe. It was horrible to see. We called ambulance right away to the hospital and he was direct to the ICU, and he did not do well. And when I think of COVID, I think of him and the people who get that sick and what that looks like, and struggling to breathe. Struggling to breathe is a terrible way to die.
Putting all this equipment on. Patients get a lot of ease from us, from our smiles, from our voice, from our demeanor. If we're calm and assertive, then that puts them at ease. Covering yourself in PPE, they do not see our smile. They do not get reassured by our facial expressions, our body expressions.
In the early morning of May 27th, the nurses came, they woke me up, and they told me that my mom was very close to passing, and would I like to go in to be with her. She wasn't conscious at this point, so I said yes, I wanted to be with her. So they took me by wheelchair into my mom's room. I held her hand. I told her I loved her, and I told her it was okay for her to go. My mom was an 88-year-old woman, perfectly healthy, still socially active. She was still driving her car. Her death should never, ever have happened.
Through this past hour, we've heard the stories of those who have worked for the last year as part of our pandemic response of the city of Hamilton. You've heard stories, sometimes very powerful and painful stories, of the impact of COVID-19 on this community. And so as we close tonight, a reminder that this is not the end of the pandemic. We are in the midst of this crisis. We still have many, many cases in our communities and outbreaks in our community. But it is also a moment to remember all of those wonderful, inspiring stories of how this community has come together to keep each other safe and well for the past 12 months, and how we'll work together to ensure we come out of this pandemic in the coming months stronger than ever before. Thank you, Hamilton, and thanks to all that participated this evening.